Good afternoon, the VC Achievers University Owo. Then all professors here seated, then the Dean Faculty of Nursing Science, Achievers University Owo, all students seated here. I am Amasia Yeni Titilayo, a PhD student of the Faculty of Nursing Science, Achievers University Owo. This afternoon, I shall be presenting a topic which says unsafe abortion and its consequences, a societal menace. These are my outline. I have the introduction, causes of unsafe abortion, effect on the society, consequences of unsafe abortion, societal and cultural impact, solution and intervention, conclusion, references. The learning outcome. I believe that at the end of this presentation, we all will be able to do what? Understand what unsafe abortion and its consequences are. Then the causes. Then we should also understand effects and consequences of unsafe abortion on the society. Then we should also be able to provide solution to the consequences that will be touched. Looking at the introduction, according to WHO, we say that abortion is a common health intervention. It is very safe when carried out using a method recommended by the WHO, appropriate to the pregnancy duration, and by someone with the necessary skill, appropriate to the pregnancy duration, and by someone with necessary skill. We need the skill, then we must note the duration of this pregnancy before it can be safe. Abortion is termination of a pregnancy by removal or expulsion of embryo or fetus. It could be with intervention or without intervention. When it happens without intervention, it's usually being referred to as miscarriages or what? Spontaneous abortion. And this is what is responsible for 30% to 40% of all abortion that occurs globally. Then, when it is done using a method recommended by WHO, which is appropriate to the pregnancy duration, which is done by a skilled person, it is usually a safe healthcare intervention. Unsafe abortion. What is unsafe abortion? We say unsafe abortion, unsafe abortion occurs due to unintended pregnancy, a pregnancy that was never planned for, a pregnancy that the person that carries never has no intent for. So it occurs due to barriers to attaining a safe, timely, affordable, geographically reachable, respectful, non-discriminatory abortion care. Then when we now look at all these things, and it is seen as a public health and maternal and child health concern, a problem to the public health, a problem to the maternal and child health caregivers. Millions of individuals, families, and communities worldwide suffer the consequences of unsafe abortion. It has constituted a silent epidemic because it claims lives of women and girls every year. Many of them died. And it leaves countless others with severe physical and emotional trauma. Despite advances in medical technology, this still continues to happen. And unsafe abortion remains a persistent problem because we have not been able to provide a lasting solution to it, particularly in low and middle income countries such as ours, Nigeria, and even in Africa as a continent. Not only does it constitute women health issues, it is also a societal menace because whatsoever affects a woman affects the man, the husband, affects the children. That means it affects, and families makes up the community. So when we look at it, whatsoever affects one family, two families in a community has already become a societal problem. So it eternalizes circles of poverty, gender inequality, social injustice. And it undermines economic development because it drains money that ought to be used to advance or to even assist with other problems that has already been planned in the budget. Because when anything happens and is claiming women's life, it calls for emergency. It calls for urgent solution. Then it perpetuates what? Gender-based violence. Women being seen as being what? has not been as important as men, because they are being seen as something that is very fragile. They are being seen as something that can cause, that can even bring problem, that can easily be affected, that can easily be that can easily have major problem that can affect the whole family. Then people now prefer to invest money to put up whatever their finances on their male children, see them as not being as vulnerable as their female children. Then it entrenches harmful gender stereotype, which I've already explained. Then consequences of unsafe abortion affect the society as a whole, because when we look at all these points, when we put everything together, the society already is affected. Then according to WHO define unsafe abortion as a procedure for termination of a pregnancy which is done by an individual who does not have the necessary training or in an environment that is not conforming to minimal medical standards. An individual who does not have the necessary training and in an environment that does not conform to minimal medical standards. What is the prevalence? According to WHO, we look at it. In 20, it has been estimated that 21.6 million unsafe abortion occurs worldwide yearly. 21.6 million unsafe abortion. This is alarming. Then this accounts for approximately 45% of abortion that is performed globally. That is, unsafe abortion accounts for 45% of the all abortion that occurs every year. The majority of this occurs in developing countries such as ours, that is 97%. So only 3% occurs in developed countries. And why? Because people don't have access to safe and legal abortion services. The unsafe abortion is highest in Africa, which I've already made mention of. Estimated that 68% of all abortion in Africa has been unsafe. Look at this prevalence. Look at this, the chart. You see, women in low-income countries, this is just to buttress what we discussed in the previous slide, are most likely to have an unsafe abortion. Why? As you see, low income, 54%, lower middle income, we have 20%, upper middle income, 5%, high income, what? We have just 1.7%. Looking at it, you will see that women in low income countries, they are most likely to have an unsafe abortion because they don't even have money to care for themselves, and most of them, their level of literacy is very low. Then this other chart shows us countries where unsafe abortion is prevalent. Rural poor women are estimated to be far more likely than urban non-poor women. Look at it. This is urban non-poor women. They have 23. Then rural poor women, they have what? They have, no, urban has 6%. Rural have 24%. All, we have 16% as a whole. What are the causes of unsafe abortion? We have lack of access to safe and legal abortion services, stigma and taboo that surrounds abortion. People see anybody that commits abortion as a wayward person, as somebody who is not fit to be seen with others in the community. Then other things, poverty and economic instability. Then we have health concerns and medical conditions such as diabetes in pregnancy, high blood pressure in pregnancy, which could be, if the pregnancy is not quickly terminated, this could lead to the death of the mother. Then gender inequalities. Then we are now going to look at the consequences under some other points. We have to look at the physical consequences. We have injuries, which could be cervical laceration, uterine rupture, bleeding, then cervical perforation, uterine perforation, cervical laceration. Then we have infections such as sepsis, pelvic inflammatory disease, abscess, then tuber blockage. Then death. You know, WHO said in 2018 that unsafe abortion causes 47% of deaths that occurred annually. 47,000 deaths that occurs annually. Then consequences of unsafe abortion continues. We have mental health consequences. We have anxiety and depression, post-traumatic stress disorders, guilt and shame. People that when they are being seen after having unsafe abortion and they now start having complications, people look down on them. They see them as somebody who has committed a great offense. Then people don't want to associate them with them. Some people even refer to them as killers. Then social isolation. People, in the environment, people neglect them. Then social and economic consequences. Without stigma and discrimination, they are being stigmatized. Oh, that's an abortionist. Oh, that's a wayward woman. Then economic burden. The money that's supposed to be used to care for other things in the country will now be diverted to caring for these women. Then loss of education and economic opportunities for the females and the women because of what? Sickness, mobility that is caused by unsafe abortion. Then reproductive health consequences. We have infertility, we have reduced fertility because some might have had tubal blockage, which will not allow them to easily get pregnant. Then complication in future pregnancy, such as what? Cervical incompetence due to several abortion with this two different type of instrument that are not even fit, and now the service may not be able to hold on to pregnancy to term again. The increased risk of maternal mortality and morbidity. Then we have maternal and child death concerns. We have social and cultural norms. These norms perpetuate gender-based discrimination. People now look at it, oh, male to have a boy is better than having a female child because a female child can easily be impregnated and the education will stop and all sort of. Then we look at perpetuation of poverty. When people now, where they don't train their female children, and the female children now they end up, they get married to a man, then all the burden of the family now will be upon that man. The man will provide for the house rent, will provide for the feeding, will do every other thing because that female child has lost the opportunity or to have the economic burden will now occur. Then we have solution. What are the solutions and the strategies that we can use to at least curb this unsafe abortion? The first thing we'll be looking at improving access to safe and legal abortion, enhancing education and awareness, supporting women's autonomy and empowerment, strengthening healthcare system. Our healthcare system should be strengthened with what? Training and retraining of manpower, provision of resources. We have instruments, equipment, drugs, and everything. Then provision of money to maintain it. Then advocacy for policy change among our policy makers and our leaders. Then comprehensive sex education at undergraduate level, because when we are talking of government, we are the first change agent. We integrate comprehensive sex education into the curriculum of tertiary institutions so that people will learn and they will know how to prevent unwanted pregnancies, and when they at least fall victim, they know what next to do. Then provision of accurate age appropriate information on sexual health, contraception and abortion. And you have people, especially most of our children in the higher institution, most of them, they are young adults and adolescents. So almost 50 to 60% of them have been exposed to sexual intercourse. So we don't need to shy away from what next to do. The next thing we need to do is just to look at how we are going to guide them to prevent them from falling victim of this menace. Then creating awareness campaign and event on campuses. Then creating a safe and confidential helpline for students to seek advice and support. There should be a helpline in all institutions for students to seek support. They should be able to call and tell people in confidence what they are passing through without even declaring their identity, and so that they can call, and by doing this they can now be referred to where they can easily seek help and be okay. Then provision of alternative solution for students facing these unplanned pregnancies, like what? Adoption, parenting resources. Put the children, after having the baby, they can be put out for adoption to people who doesn't have children and who needs babies, and this should be done legally. Then what are the roles of students in prevention of unsafe abortion? We as students, we have a lot to do. First thing is adequate reproductive education. We should get ourselves well educated about what could happen after getting married, pregnant. How could I prevent unsafe pregnancy, unwanted pregnancy? What should I do if peradventure I become pregnant and I don't need it? Then use of ABC of prevention of STI. This is still going with that. Then family planning. When you don't need a baby, you have to plan to prevent it. Then formation of advocacy support group in the schools. Youth can come together, start talking about it. Advocacy group that are being supported by NGOs who are after adolescent care and This will help to prevent what? Unsafe abortion. The role of women in prevention of unsafe abortion. We as women, mothers, we have a lot to do. The first thing is what? We go for family planning. And before you can do that, you must also be skilled. That is when we talk of women empowerment. When you have your money, you have a work you are doing, you can easily gather some little amount and go for family planning if you have had the desired number of children, so that you don't continue to have children that you will not be able to do or to cater for and constituting problems in the environment and in the neighborhood. Then medical checkups and screening. Before you go for you get married, a woman should do at least medical checkup 6 months, have a baseline data of her health system, how her body works and every other thing, so that they can easily diagnose anybody who can easily be prone to what? To developing pregnancy-induced hypertension, diabetes mellitus in pregnancy. And these people will have been treated prior to the period they get pregnant, so that they will not now be looking for a way to terminate pregnancy when this type of problem now shoots up. Then health education to our children from cradle. You educate your child. You tell them the pros and cons of sex. Let them know what they, when they ask you questions, tell them what they need to know. Do not shy away from telling them the truth. Then social support system. If peradventure your female child now get pregnant and she confide in you, do not castigate her. Make her your friend. Care for her. Then encourage her. After putting to bed, then you can gather up things and take the child from her. Encourage her to go back to school. This will make them to at least be able to prevent having unsafe abortion and also to save their own lives. Then improve access to safe abortion. This is done by, this should be done, is the responsibility of what? Of our leaders. They should ensure law and policies that safeguard women access to safe and legal abortion, increase availability and accessibility of safe abortion services. Every nook and crannies of our health centers, we should have trained people who can at least provide care for people who are already vulnerable. Then training of healthcare providers in safe abortion care. There should be training and retraining of healthcare providers, both the doctors, the nurses, the counselors, and everything. Then establishment of robust referral system for comprehensive abortion care. People should immediately, you see a person that is having or that has already undergone unsafe abortion and is having complications, refer them. Do not hold on to such a patient so that you don't incur more mortality. Then enhance education and awareness. How do we do this for everybody? I think we should first do one thing: implement comprehensive sexuality education. Everybody, both the fathers, the mothers, the children, everybody must be well equipped about sexuality and education. Then by providing accurate age-appropriate information on sexual health, relationship and reproductive. But this education should be according to health. What we need to train toddlers is different from what we should tell people, children who are just children. But when they get to adolescence, their own gradually. Then when they are young adults, we tell them. Then the mothers, the fathers too. Everybody, the education should be according to the age. Then promote accurate information about abortion and reproductive health. By what? Challenging harmful gender stereotype and stigma by encouraging positive gender roles. You encourage positive gender roles. Tell your female children that you can be whatsoever you desire to be. There is no limit. There is no, so nobody should be, you should allow them to know that there is nothing a man can do that they cannot do, so that they will be able to see themselves as somebody who can become the future leaders of tomorrow. Then addressing societal stigma and around abortion. Talk to people. For if by a child mistakenly get pregnant, well, out of wedlock, that should not be the end of everything. They should encourage that child to have a child. After having that child, you can go back to school, so that the child will not see herself as being a failure. Or it's true you have disappointed your parents, but you can still make it. That should not be the end to such a child's career. Then we do what? We engage communities and religious leaders advocacy efforts. Because these are our leaders, the imams, the church leaders, the chiefs, they are the people that we so much believe in. So they should be encouraged on advocacy effort Talk to these people. Let them tell their people, oh, that your child has been impregnated, though. That doesn't mean it should be the end of education. That you have a female child, that doesn't mean the child cannot become somebody great. So that everybody will be on the same page. Then strengthening healthcare system. How do we strengthen our healthcare system? We improve healthcare infrastructures and equipment. We buy drugs, buying adequate drugs to the hospital, then adequate equipment that is needed for all these women care. Then we do what? We do training and retraining of our health workers so that they will know what and what. They will know the modern trends in caring for women. Enhance healthcare provider skills and technology, which I've just mentioned. Then ensure access to essential medicine and technologies. Essential medicines and things that are very, very important in the current management of women so that there will be no complication. Then addressing social and cultural barriers. How do we do this? We engage with community and religious leaders to do what? To challenge harmful norms by collaborating with influential leaders to promote positive social change. That your child has been impregnated doesn't mean it should be the end of that child's education, or that you have a female child, that doesn't mean the child cannot go to the university and become a medical doctor, become a nurse, become a lawyer. So you talk to them, then this will encourage them. They will be able to do what? To make sure that all their female children are skilled. Then promote positive social and cultural change. Then support women empowerment and autonomy. Every female child before getting married must have something that she's doing so that she can support the husband. The whole family burden will not be on the husband. Then encourage these men engagement in what? Reproductive health and rights. Tell the men they can also, when they have had the number of children that is needed, they can also go for vasectomy. And they should also support their women that want to do this family planning so that the women will not be so scared and be afraid, if my husband should hear this, how will he feel? Will my husband see me as a wayward woman also? So if all these are put into consideration, then conclusively we will have what? Look at it very well. Unsafe abortion should be seen as a complex issue that requires what? Multifaceted approach to address. So to address unsafe abortion, it is essential for us to do what? To improve access to safe abortion services all over. Everybody must be able to have access to it. Then we should enhance education and awareness, support education and awareness for all ascendants. Women, men, children, adults, everybody, the grandmas, the grandpas, so that people will forget about the norms and the culture that encourages stigmatization. Then support for women's autonomy and empowerment and advocates for policy change. So, my people, when we look at it, should government legalize abortion or should we allow our women to continuously suffer morbidity and mortality of unsafe abortion? This should be a food for thought. Let's think about it. And we should also remember, say no to unsafe abortion. And remember, abortion is an health care. These are my references. Thanks for listening.